Hi, Honorato, how are you?
Hi, Francisco. Everything okay?
Yes, everything is okay. You remember the other day at lunch with our discussion about the prefabricated abutment and the customized abutments?
Yes, we were discussing about the lack of long time evidence about that subject.
I was doing research at the internet for a paper, and I discovered a very interesting paper about this topic. Can I show you a little presentation?
Yes, of course, Francisco.
This paper is at the International Journal of Prosthodontics. And this is a retrospective study with 10 years of follow-up about the prefabricated use of abutments. The aim of this retrospective study was to evaluate the survival and mechanical complication of posterior single implant supported restorations using prefabricated titanium abutments. Here they include 85 patients, 172 dental implants of Astertech osteospace, and divided the patients in two groups, in premolar and molar areas. And the fluxogram here I can show you is all the steps that they use to perform this study. Extraction, implant placement, impression, crown delivery. After the crown delivery, they follow up for every 6 or 12 months each patient for a period of 10 years of follow-up. The clinical outcome was implant abutment survival rate and mechanical complications. In terms of complications, you can see only 14 mechanical complication, giving a 8.2 mechanical complication. And in terms of failures, very few failures. You can observe here implant cumulative survival rate at 97.7% and the abutment cumulative survival rate 98.3%. This number of mechanical complication, this 14 complication, is a group, the 2 screw fractures or for decimentation. This decimentation occurred probably because they use provisionary cement. Yes. But when you read all the paper, you're going to understand these limitations of this paper. In terms of conclusions, posterior single implant supported using prefabricated abutment show a high survival rate to up 10 years of follow-up. No statistical difference when comparing implant position, implant diameter, or abutment angulation were observed. This results, you can say, a favorable outcome for the using prefabricated titanium abutments. I hope this opened your curiosity, Honorato, for reading all the complete paper.
Oh, thanks, Francisco, for providing me all the time with the latest evidence.
See you soon, Honorato, for another
See you soon.
Another discussion.
See you soon, Francisco.
See you. Thank you.